Werbner. I'm the town manager of Tolland. I'm a member of the CCM Board of Directors and chairman of their...
Could you turn your mic on?
Sorry. Thank you, chairs and members of the committee. My name is Steve Werbner, town manager of Tolland. I'm a member of the CCM Board of Directors and chairman of the CCM Committee on Labor Relations. CCM opposes Senate Bill 593 as a new unfunded state mandate on municipalities. Identical to proposals from previous years, this bill would mandate the expansion of workers' compensation coverage to all individuals, private and public employees, with an emotional or mental impairment. The consequences of mandating such benefits would impose a considerable negative impact on local resources, particularly as many towns are managing shifts in state aid and brainstorming new means of efficiencies. The Office of Fiscal Analysis, nonpartisan staff have acknowledged that this proposed unfunded state mandate would result in increased premiums for towns and that other consequences of this proposal would result in a wide range of potential per-claim costs on already struggling local budgets. Let me be clear, the dedication and services of our employees, particularly our first responders, is not an issue. Whereas that question is whether local property taxpayers should be mandated by the state to provide special mental benefits from witnessing a crime scene or its aftermath without any financial assistance from the state. If the state deems this bill essential, it should pay for it. The state is in a better position to do that than our towns and cities. Similar to debate on special education funding, no one county should have to individually bear the burden of claims of this nature. Senate Bill 593 is overly broad in a number of areas. Areas such as visually witnessing is subject to interpretation. The definition of death is subject to interpretation, as is the definition of maiming. A diagnosis of mental or emotional impairment as proposed in this bill is highly subjective and could overlap with existing symptoms of depression, substance abuse, or other anxiety disorders. The issue of determining how to assist Connecticut residents who are affected by certain tragic events must be solved, as I've said, on a statewide basis. No individual municipality should be mandated to shoulder the burdens of these special benefits. We would ask that you consider the following approaches, if there is an interest in moving forward with a proposal similar to this. Dedicated percentage of the state's rainy day fund to support the Workers' Assistance Fund, which was created 2 years ago. Amend the eligibility of the fund and the deadlines to access the fund by making it a permanent statewide resource that could be modeled after the second injury fund that shares the burden of extraordinary events via both the state and local. Convene a working group to better vet these ideas and better vet the definitions that are contained within the bill and look at other statewide approaches of which CCM would be eager to participate. Related to the idea about establishing a separate fund and perhaps providing a dedicated source of revenue for such a fund, the legislature should look at perhaps dedicating a percentage of the revenues generated from certain infractions such as speeding tickets or a new surcharge levy on all criminal offenses, including motor vehicle offenses. Other sources possibly could be restitution funds, subrogation reimbursements, and other similar revenue which is coming into the state from similar areas. We would urge that the General Assembly and this committee take no action on Senate Bill 593. Quickly, I would also like to testify and provide CCM support on House Bill 5211, which would amend the state statutes to establish that decisions rendered pursuant to the arbitration of unfair labor practices and grievance awards be issued not later than 60 days after the post-hearing briefs are filed. Also, in addition, House Bill 5070, CCM would support in concept, but at this point in time, we are focusing on the grievance arbitration bill. This particular bill, 5070, would require all municipal employers and municipal employee organizations engaged in mandatory binding arbitration to complete negotiations within 1 year from the date that the binding arbitration was imposed by the state. Do you have to answer any questions?
Other questions from members of the committee? I have a question for you. You suggested that the bill is you have opposition to the bill. You suggested that it was overly broad. If that were dealt with, would you support the bill?
I think there are two areas that we're concerned about. One are the definitions, the other are the funding sources. The funding sources are extremely important. to local municipalities. As you're aware, we have over 1,000 currently unfunded state mandates that we're dealing with. We're looking at the possible reduction in state aid at this point in time, and for the towns to burden even a bill that was well-defined, the economic impact would be something that we individually could not withstand at this particular point in time.
So the answer is no?
No.
Thank you.
Representative Bonnie, do you have a question?
I do. Thank you. Good afternoon. I'm sure CCM's position is a concern about the financial implications and not about the health and welfare of the people that provide the services to the municipality. Having been a chief elected official, when I look at this, I think, you know, there are none of us that are inconsiderate of what the health effects of continuous traumatic experiences might be to an individual. So in terms of opposition, I'm hopeful that there's an opportunity to sit down and kind of work through what I normally refer to as the grocery list of things that you can agree on and the things that pose some risk. If the funding mechanism were taken care of in some way where it was, as you suggested, maybe another stream of revenue, does that kind of set that issue aside, or?
Yeah, I really think there is an opportunity to sit down, as you said, and discuss where there's agreement, disagreement. But if the funding mechanism was set aside to minimize the impact on any one particular municipality, I think the other issues could most certainly be discussed and reasonable people could come to an agreement.
And if I could, so the conversations that I've had with people over the summer have kind of focused around treatment and less about the continuation of the disability. Do you think if we focused on early intervention, consistency of treatment, removing what I think some refer to as barriers, would that be a good first step?
I think that would be an excellent first step. But I think a lot of other states concentrate on that rather than wage laws. I think that would be an excellent first step to begin the discussion.
And the last question, if I could, you contracted governs the relationship between your employees, municipal employees, and yourself. Is it a 20-year now, 25 year?
Well, fortunately, in the municipality that I'm in, we have a very small paid fire department that doesn't have that type of provision. The community that I was in before, which was Manchester, had a 25 and out, and they may have lowered that to 20 since I've left there.
And so, would you give some thought to whether or not that, I don't want to refer to it as a bonus, I think it's a recognition of the difficult job, but we have, I think on the agenda today, or at least we will have, consideration of different classes of employee that want to be included in that kind of category. Should that be part of the conversation if we're talking about a mental disability? It seems to be, in some cases, an overtime collection of witnessing the same kind of event in some.
I think before in your discussion with the senator, you raised the difficulties associated with rating mental disability and the ability at the local level, if you're talking about whether a pension system could allow for somebody with a mental disability to go out with a worker-related disability at some point. The litigation that you would get into at the local level and trying to determine that, the administrative cost associated with that would be just so burdensome, and that's why we've really focused on this being a statewide system that would relieve any one municipality of having